X-rays in medicine. In this video we'll cover the applications of X-rays in medicine. X-rays, being part of the electromagnetic spectrum, consist of photons of high energies. Because of the high energies, they are able to penetrate different materials to varying degrees. When X-rays are incident on photographic plate, they can expose the plate and produce an image. So the ability to penetrate the material and produce an image make them useful in looking inside the human body non-destructively. X-rays cannot be focused with a lens as used in visible light, and because of their penetrating power, special safety precautions have to be taken when using X-rays. The image produced on the photographic plate due to X-rays depends on a number of factors. This includes the absorption of the X-rays by the material, the penetrating power of the X-rays, and the length of exposure. Different types of body tissue absorb X-rays. The degree of the exposure of the photographic plate indicates the extent that the X-rays were absorbed. This provides information about the tissue that the X-ray has passed through. The degree of absorption is called attenuation, and three different factors affect the attenuation of X-rays. This includes the density of the tissue, the thickness of the tissue, and the atomic number of the elements within the tissue. The more dense a material, the more the X-rays are attenuated. Different tissues in the body attenuate X-rays to a different degree. X-rays that pass through bone are attenuated a lot more than those that pass through muscle, for example. So the photographic paper is more exposed when they pass through the muscle compared to the bone. The thicker the tissue, the more likely X-rays will be absorbed by the tissue. If a large bone is shown on an image alongside smaller bones, for example the hand compared to the arm, the large bones would stand out a lot more. And also in this image on the screen of the skull will absorb a lot of the X-rays because it's really thick compared to an area such as the nose. Attenuation also depends on the size of the nucleus of the elements within the tissue. The greater the atomic number, the greater the size of the nucleus, the greater the attenuation. So normal body tissue is comprised of the lower elements such as carbon, hydrogen, nitrogen, and oxygen. But metals within the body, that might be due to pins or fillings, have a much higher atomic number and appear brighter on X-rays. The penetrating power of X-rays also affects the image that's produced. The greater the energy the X-ray has, the further they can penetrate into the body. X-rays are described in terms of their hardness, with a hard X-ray having high energies, having more penetrating power, and these can be in the order of 150 kilovolts when the high voltage of the X-ray apparatus is applied. Soft X-rays might be used for taking images of muscles and softer tissues, and these X-rays might be in the order of 50 kilovolts. So it's important to select the hardness of the X-ray depending on what you're taking a photo of. If hard X-rays, for example, were used on soft tissues, the X-rays will pass straight through and a satisfactory image will not be produced. Finally, the length of exposure is important when taking. This impacts on the intensity of the X-rays or the number of the X-rays that hit the photogenic plate. The image on the screen here is an X-ray of a woman's hand using two different X-ray apparatus. The one on the left is an old X-ray apparatus where the length of exposure was long, and you can see it's a little bit fuzzy compared to the one on the right, which uses a new apparatus. So the one on the left here, there might have been slight movement from the woman over the course of the 21 minutes that causes the image to be a bit fuzzy. But with the new technology, less exposure time is required, and you can see you get a more crisp image. As X-rays have high energies and can pass through our skin, it's important to minimize the time of exposure for safety reasons, but also control the hardness of the X-ray appropriate to the application. So to produce the best image, the hardness of the X-rays needs to be chosen, the intensity of the X-rays, followed by the time of exposure. List three different factors that can affect the image produced by an X-ray machine.